Hmm. Mm-mm-mm-mm-mm-mm-mm. What's up, peeps? Assalamu alaikum. Shalom, peeps, peeps. I Hotel. What's up with it, peeps? This is your boy Azakar. Bring you that thunder. I ain't in OKC. You feel me? It's some bullshit in the game, y'all. Just like this video, share, subscribe, hit that notification bell. You be notified every time your boy drop any type of content, man. It's just some bullshit in the motherfucking game, man. So whoever been laid off or going through light limited duty, hazardous pay, whatnot, when it's time to get these little medical alternative services that you may need, and due to this pandemic, you're not able to go through on your, well, some people ain't able to go through their obligation. It seems like when you got your ends already, your I's dotted and your T's crossed, you good. But when you go to the doctor or something and let them know information, it's always, well, sir, you have to go check back with this or this. It's just a bunch of bullshit, you know? Typical shit. For the basic person who's working every day, they gonna face a whole bunch of bullshit during this pandemic. You know, trying to get things done. It just don't go down like it's supposed to. Alright, y'all. So I'm gonna get into this article, man. It's fucked up. Profit over people. Cost over care. America's broken healthcare exposed by the virus. Ooh, shit. There were 27.9 million people without health insurance in 2018. A record high unemployment will increase the figures by millions. Wow. I listened to Dr. Boyce Watkins, man, and he was telling me, well, telling us, that the people who seen the crash coming ahead, they say they thought it was gonna be, they knew it was gonna get bad, but they didn't know it was gonna get this bad. So we finna go through some fucked up times, y'all, man. And I don't think I can ask y'all to be strong, stick that shoulders square back, stick that chest out, and do what it do. You feel me? With over 21,000 people dead and more than 547,000 infected with the coronavirus in the U.S. in the last questionnaire, on a person's mind should be, how will they pay for living life-saving treatments? How will they do that? But as the death toll mounted, patients who were about to be put on a ventilator on one of the New York City stretch capacity intensive care units had a final question for his nurse. Who's going to pay for it? Who's going to pay for it? See what I'm talking about? Dotted I's, crossed T's, who's going to pay for them? Those were the patient's final words to his medical team. Derek Smith, nurse anesthetist at a New York City hospital, wrote on a Facebook last week, next level heartbreaking, having to hear a dying patient use the last words to worry about healthcare finances. That's a hard hitter, man. You feel me? God damn. In the wealthiest country in the world, the COVID-19 pandemic has exposed the core of a healthcare system that is structurally incapable of dealing with pandemic. Federal and local governments, health insurers, and employers have pledged to help Americans pay their way through the crisis, but so requires a dramatic overhaul of a system which for decades prioritized cost over care. Want cost over care. Goodness. Cost over performance. You know what I'm saying? As this epidemic makes clear that any moment any of us could become sick and could become hospitalized. That's what they say. You know, I'm just doing me. Could be on a medical ventilator, said Adam Gaffney, an ICU doctor in Boston. And had that, the United States could mean potential ruinous healthcare costs. Wow, wow, wow. And I believe he said, I heard of patients saying they've skipped their inhaler because they couldn't afford the dose. Wow, Gaffney said. I've heard of patients who've gone from years without primary care because they were uninsured and wound up in the ICU. God, man, this is so fucked up. So fucked up, y'all. Sad. Sad, but you got to, like I said, stand on what you believe in and keep sure you take care of yourself. Eat good. Exercise. Meditate. Get your blood pressure down, you know. Because right now we're at a time that we're in the hells of, everybody's in the hells of North America. This is some fucked up shit. And they ain't got to die to experience hell. They're experiencing hell right now. Am I talking to somebody? As Dr. Khalid Muhammad said, what, talk black to me? Vicky Dillon say, talk black to me. That's my girl. Hey, subscribe to Voice Walkers, Vicky Dillon, man. Who else? Who else? Ticket TV, ISUPK, Farrakhan and Vice. Man, subscribe to all of them, man. It keep it grounded. Dr. Boyce Watkins, subscribe to him too. You know what I'm saying? But yeah, I like this video. Valor Denise Jones, excuse me. Yes, subscribe to her channel too. Yes, yes, yes. But yeah, like this video, share, subscribe, hit that notification bell. Hopefully be notified every time I drop any type of content. Peace and a bottle of Grease.